Hello, I'm Dr. Ho In-shik. This is the second lecture. We are going to talk about TRIOS, which is the representative intraoral scanner. Intraoral scanner is the first equipment that you need to use for the digital workflow. Without it, the digital workflow like this cannot be started. So if you want to enter into the digital dentistry, you need to purchase the intraoral scanner first. Up to now, I have used many different intraoral scanners. The scanners, whatever they may be, their output is in the form of triangular mesh structure. So the image output data in the form of STL file can be brought in to the design programs such as AutoCAD or 3-shade program. They represent the scanned images in the triangular mesh structures. So with this, we are doing the design. TRIOS scanner is manufactured by 3Shape, a Danish company, Carestream, and Medit Scanner in Korea are using the AutoCAD, which is an open-type CAD program for designing. TRIOS scanner is using the dental system, which is a proprietary program of 3Shape. The analogy can be Android phone versus iPhone. You would understand the difference between those two. Likewise, PC based on Windows and the Apple computer based on Macintosh can be the difference between those two. The biggest advantage of TRIOS scanner and dental system, it has very intuitive workflow. If you do several clicks, you would be able to understand intuitively how the process is working. You will be easily understand the process. Second, it has superb data reliability. This is very important function, especially for those who are beginning the digital dentistry. While designing, the computer may go down and blackout can occur. TRIOS can recover the data as it was right before the problem. The mistakes are tolerated. The third, it has rich design convenience. Its anatomical shape is very aesthetic or pretty. Depending on users, very difficult cases may exist. In the lab, AutoCAD-like specialized programs are used. In a dental clinic, when we have many different cases in terms of difficulty, the intuitive programs like TRIOS or AutoCAD, such programs may fit better in a dental clinic. One disadvantage of that is some require maintenance annual fee. Over time, I realize it's worth it. How to use a TRIOS scanner? Let me explain that. First, when we do the scanning, anterior scanning versus posterior scanning, as you can see here, scanners love to scan 3 dimensions. The biggest problem with the anterior scanning, as you can see here, the scanning should be overlapping with each other. Buccal and lingual images are overlapping. Why do we have that problem? Posterior and anterior regions are different from each other in many aspects. In the posterior region, occlusal plane is straight. However, in the anterior region, there is the curvature. So in the posterior region, you can scan in one direction, whereas in the anterior region, you need to change the angle of the scanning continuously. Anatomically, posterior and anterior regions are different. In the posterior region, the occlusal table is quite wide, whereas the occlusal table in the anterior region is quite narrow. So when you do the scanning in the posterior region, a lot of areas are scanned at the same time, which is not the case for the anterior region. In the posterior region, we need to scan the occlusal surface first, and you need to change the angle a little bit to scan it again. The red portion is the overlapping portion. Using that red portion, we can connect the scanned images continuously. So if you change the angle a little bit, you can connect the images. But in the anterior region, if you scan lingual followed by buccal size, the scanned images of those two do not have the overlapping area. Therefore, the images, two different images are acquired and they cannot be used for the designing because it is not accurate. Then how do we need to do the scanning? The reference points of the scan need to be scanned first. So incisal scanning should be done first and then change the angle a little bit. So we need to scan with overlapping areas. Then we'll be able to connect the images. We need to remember that in the anterior region, incisal edge should be scanned first, followed by lingual and buccal size. This is a question. What is the biggest enemy in acquiring accurate scanning? What kind of materials or surface in terms of interaction with the lights? First, reflection. Light reflecting materials. What would reflect light? First, the gingival-clavicular fluid near the teeth, saliva, blood, and most importantly, metal surface, prosthesis, reflect the lights. In that case, the scanning can be done inaccurately. As you can see, a cord is inserted, the final prep is done, and it is finished. You can see the bleeding in place. If you scan in this case, accurate scanning cannot be acquired. Therefore, the bleeding points, we need to give some drug or laser treatment for hemostasis. It should be scanned after the margin is completely exposed and the treatment is done, and the crown needs to be done as well. The crown is very short. Crown lengthening would be necessary. In this case, laser or electrosurgery can be used to lengthen a tooth. When you cut the gingiva, bleeding can occur. After bleeding is stopped, as you can see here, if you do the prosthesis on the day, the prosthesis can be completed. Likewise, the crown of the second molar in the mandible is very short. So for prosthesis, a lot of distal mucosa should be cut or gingivectomy. Then it will bleed, and the bleeding should be stopped before scanning. Without inserting cord, accurate image can be obtained for the designing work. The crown is designed. After final crown is fabricated, electrosurgery is done for gingivectomy. On the very next day, the crown is set. The crown of the upper second molar crown is very short. Electrosurgery and laser is used for gingivectomy, and the scanning is acquired after hemostasis, and crown is fabricated, and on the very next day, the final crown is completed. The biggest problem is this. There are so many prostheses in the mouth of a patient, especially gold is reflecting light, so scanning is challenging. The recently launched intraoral scanners have excellent metal scanning capability, but still, if there are so many prostheses, the scanning can take more time. So in that case, powder should be sprayed to eliminate the shininess of the metal surface before scanning. There are many different powders for scanning. The first powder is not for oral scanners. It is used to measure vertical dimension of occlusion. Such powder is hard to adjust the thickness, and the spraying outlet is straight line, so it's hard to spray powder evenly, so it is not recommended for oral scanning. The second is the Vita Scan powder, and the third one is Cerac Opti Spray. Based on my experience, create the surface to be scanned appropriate. Let's talk about how effectively use the intraoral scanner. Trios 3 scanner. The number of cuts are increased on the screen continuously. The problem is it takes a long time, and if it is over 1500 cuts, warning is displayed. However, Trios 4, if the cuts increases more than 2000, a warning will appear. Scanning is made, but the data is voluminous, taking a lot of time for rendering and giving burden to the computer. So Trios 4 is for cuts under 2000, and Trios 3 for cuts under 1500. This is the video how we use the Trios in our clinic. When you use digital equipment, if you have a big screen on the wall, when you do the digital work, a lot of images can be shown to a patient. A big advantage, so when you set up digital devices, you can refer to this. The biggest advantage of Trios, the dental system program, is that there is a no click on tragedy. The scanners I used to use, when I do the scanning, some problems occur and computer crashes and the data is gone. You cannot recover it, but with the Trios, during scanning, when the program or computer crashes, the data is still saved, so you can recover the data. Especially when you are a beginner who embark on a digital workflow, it's very important. When you do the digital work, taking a lot of time, if the data disappears, it is a tragedy. I want to emphasize that this is the biggest advantage of using the Trio system and the dental system. Second, pre-scan occlusion recording. If you do scanning first, on the right, pre-prep option is available. Before you reduce the abutment in the mouth, before the reduction, the image is taken. The occlusion is recorded. After that, abutment can be reduced. First, mandible is scanned, and then maxilla. In this case, abutment is in the maxilla. After that, it is scanned before reduction, followed by scanning occlusion. Pre-prep is important because when you scan the occlusion after tooth reduction, the accuracy would be considerably lowered. So pre-scan occlusion recording is very important before reducing the tooth. So occlusion is scanned first and occlusal points need to be checked. After that, abutment is reduced. After that, preparation is done and final abutment scanning is done. Very important function. This is the big merit of Trios system. Another advantage is the lateral guide function. After acquiring occlusal surface, Trios can record the lateral guide in a video. This video shows the patient grinding his teeth. Like this, the lateral guide is recorded during scanning, and the recorded data is saved, and that can be later called in when a designing for crown is made. During designing, the patient's guide can be reproduced like this. After crown design, the guide is reproduced and the guide can be applied to the design, automatically eliminating the occlusal interference that occurs during lateral occlusion. If you use the function at the stage of setting the prosthesis later, the time taken for occlusal adjustment is considerably reduced, especially for the lateral guide. Another advantage of Trios is zoom in and zoom out. After overall scanning, a specific part like margin or abutment can be zoomed in or zoomed out in the scanning. After overall scanning, after that, zoom in or zoom out can be applied, so the scanned image, a part of the scanned image can be zoomed in or zoomed out. If you use zoom in or zoom out from the beginning, the field would become too narrow, so scanning cannot be done. So it should be used at the last stage of scanning as an additional scanning. If you scan like this, on the mesh structure, the zoom in scan of the abutment can be scanned more precisely. Then on the more precise data, a crown can be designed. Next, let me talk about the mesh structure strategy. Depending on a scanning company, they adopt different strategy. The STL file from the Carestream scanner uses the strategy of scanning evenly and more densely. If you look at here, there's not much difference in the size of the mesh structure between the abutment, adjacent teeth, and gingiva. Likewise, there's not much size difference in the mesh structure between the crown, adjacent teeth, and gingiva. However, in Trios scanner and dental system, there are differences. Around the abutments, more detailed scanning is done. Therefore, reproducibility of margins and other parts is more superior. However, for the adjacent teeth and crown, the mesh structure is not that dense, so it is a strategy of select and concentrate. After scanning the mouth using Trios, we need to check some things. First, prep margin should be read. Recently available intraoral scanners can scan anything that is visible. In the past, just up to several years ago, the designing CAD software used to be black and white. So the protocol recommended is for subgingiva margin preparation. The designing could not be done because there was no way to distinguish margins from gingiva. So a lab used to ask us to make a supragingiva margin. However, ExoCAD or dental system, whatever the design program may be, most of them support color images. So with the colors, margins can be distinguished. Image before preparation and prep is done. On the CAD design image, gingiva and teeth are distinguished with the different colors. Based on the colors, margin is designed and the final crown is completed. Second, occlusal acquisition. This is the most important point of intraoral scanning. Like this. If you prepare multiple teeth in the posterior region for prosthesis, pre-prep mode should be used. You need to record the teeth before reduction. As I said before, if you try to acquire the occlusion after teeth reduction, it will be very hard. In a multiple or free-end case, pre-occlusal function should be used to acquire accurate occlusion. Multiple teeth need to be restored in this case. It is hard to check whether accurate occlusion is acquired. Trios scanner can acquire very accurate occlusion in cases like this for bilateral prosthesis designing. What is the proper occlusion? So these are the two different scan images of the same patient. For number one, the occlusal point or the depth of occlusion is similar. So the patient bite is similar between left and right. However, if you look at number two, on the left image, the occlusion is very deep, but on the right, it is pretty shallow. So one of them is not right. So after scanning, after marking the occlusal points, we need to check whether the occlusion is accurate or not. If you neglect this process or step, it will take a lot of time for the occlusal adjustment, or you need to remake the prosthesis. It is very important to check the amount of teeth reduction and whether the prep is appropriate or not. After the prep, you don't finish it like that. You need to check whether the tooth reduction is appropriate or undercut exists. How do you do that? If you click on the tooth icon at the top, the menu would appear at the bottom. You click on the gap. If you look at here, the red color on the abutment indicates lacking of tooth reduction, and you need to modify that. If you want to check the undercut, first you need to click on the direction icon, and you need to check whether red color exists surrounding an abutment. In this case, undercut is indicated as red in the adjacent tooth, but there is no undercut in the abutment, so there's no red color there. This is how you get the scan data. If there's a deficient portion, under-reduced portions are cut off using the cut and trim menu. red color portions are deleted and it is scanned again, then complete scanning is achieved without red colors with appropriate reduction. Then scanning is completed and you can move on to the next step. In conclusion, do not hesitate anymore and go and purchase intraoral scanner. Main intraoral scanners on the market provide us with excellent images. Among them, Trios intraoral scanners provide excellent scanning outcome, and it is linked with the dental system, which is the CAD program. So I strongly recommend you to use the Trios 3 scanner. Q&A. First question. What need to be considered in purchasing an intraoral scanner? Many people, when they purchase a scanner due to economic reasons, tend to choose a low-priced one. The most important thing when it comes to purchasing a scanner is not just considering the scanner itself, but you need to think about how you are going to use the CAD software for the designing. When you purchase a scanner, if you think you just do the scanning and the rest of the work will be done by a lab which doesn't have any problem in using the image that you scanned, then you don't need to buy an expensive scanner. But if you want to do the design work yourself, you need to buy an intraoral scanner which can do the designing work very well. The second question, when scanning abutment, do we have to make the reduction margin as supragingiva? As I said during the lecture, up to several years ago, for digital prosthesis, there were many lectures saying supramargin prep should be used when the design program was black and white. But recently available scanners like Trios 3 or Trios 4, it doesn't matter whether it is a supra or submargin. As long as the margin is dry and is visible, the margin can be accurately read. So it doesn't have to be supragingival margin. So this question is irrelevant. Among the scanners, especially Trios 3 or Trios 4, can accommodate submargin as well. I've delivered a lecture in a limited time, and I believe you have more questions. More details will be included in the offline digital dentistry seminar. This concludes today's lecture, and in the next time, I'm going to talk about whether prosthesis is to be milled or printed. Thank you.